I am signing an executive order today requiring all workers in healthcare settings and high-risk congregate living facilities, including our correctional facilities, to be up to date on their vaccinations. That means both primary course and booster, with no test out option. It is important to remember that for those working in healthcare settings, the test out option is already coming to an end due to the Biden administration's vaccine mandate, which the U.S. Supreme Court upheld last week. For those in our healthcare community who remain unvaccinated, you have until January 27th to get your first vaccine dose, and you must complete your primary vaccination series by February 28th. For those of you who work in high-risk congregate living facilities, we want to give you some more time. If you are unvaccinated, you have until February 28th to get your first dose and March 30th for your second. Again, healthcare workers, January 27th to get your first, February 28th to complete your series. High-risk congregate facilities, February 28th to get your first, March 30th to finish your series. But the science tells us that it's no longer good enough to just receive your primary series, as being boosted is necessary to protect yourself and those around you. Therefore, everyone who works in these settings is now also required to get their booster. If you're currently eligible, but you haven't gotten it, please go get it. Currently eligible healthcare workers, again, have until February 28th, and high-risk congregate living facility employees have until March 30. For those of you who are going to become booster eligible beyond those cutoffs, you'll have 3 weeks from your booster eligibility date to get that added dose. Again, for workers in these facilities, testing out will no longer be an option. The only exemptions will be granted for disability or other medical reasons or for deeply held religious beliefs. Anyone found in noncompliance will be subject to their workplace's disciplinary process, up to and including termination of employment. We are no longer going to look past those who continue to put their colleagues, and perhaps, I think even more importantly, those who are their responsibility, in danger of COVID.